So it is 9:33 a.m. I'd like to call the February 16th HHS committee meeting to order. Under 7E OMA, our members are invited to participate virtually. We have the requisite officers present at our regular meeting locations. Online and in person, comment is provided for with the health protocols are in the room, and all votes are going to be roll call votes today. So roll call, please.
Chair Renahan?
Here.
Vice Chair Swarzy?
Here.
Member Solomon?
Here.
Member Chaplin?
Here.
Member Dessert?
Here.
Member LaPlante?
Here. Do we have any public comment today?
Public comment.
So with that, I'd just like to thank everyone who took part in the Care Center Valentine fundraiser. There were some amazing pictures, if you saw on social media, over 900 balloons, lots of happy people smiling. And so, you know, it's great that we can be part of that. I was able to reach out to Scarce, and they're going to be providing some word searches and cards and that kind of thing. So we'll get a little relationship going over there with the Care Center, which is just a nice little happy note. And so with that, I'll ask for a motion to approve the minutes of the February 2nd, 2021 meeting.
So moved, Chaplin.
Second, LaPlante. Great. Any additions, corrections? All right, roll call, please.
Member Chaplin?
Aye.
Member Dessert?
Aye.
Member LaPlante?
Aye.
Member Swarzy?
Aye.
Member Solomon?
Aye.
Chair Renahan?
Aye. And moving on to community services, I think what I'd like to do here, Mary and our assistant state's attorney here, is to move our informational item 11 up in our agenda today, because it is a notification and then we're going to be taking action on this informational item. So first let's realize that we have it and then we can take action on it. With that, I will take a motion to receive and place on file grant proposal notification 12-21 for Giving DuPage staffing grant in the amount of $20,000.
So moved, Chaplin.
Second, Solomon.
Any questions, comments? Mary, do you want to just say a couple words here?
Yeah, sure. Actually, this kind of ties in with the conversation that just happened at Economic Development. So the Giving DuPage board recognizes that there is additional staffing resources to really make the program, the organization as effective as possible, but not wanting to request any additional funding from the county board. The Giving DuPage board voted to use some of the funds that they have fundraised to offset the cost of increasing a part-time staff person to a full-time. So Giving DuPage will be covering the additional salary cost as well as the additional benefits associated with it. So this, as I said, this goes in line with what I believe is the will of the board, which is that Giving DuPage should work wherever possible to be self-sufficient and not request additional resources coming from general fund. So what will happen is we'll be upgrading a full-time, we'll be upgrading a part-time person to a full-time person with that cost differential being charged to the Giving DuPage grant. I apologize that I didn't put it on the agenda first. This is sort of because this is sort of an internal kind of situation. It's you know, the typical practice is that the grant proposal notification goes on at the time of an application, and then when we actually accept the funds, the acceptance and appropriation go on. So it's typically there's typically a time span. The Giving DuPage board authorized the use of these funds at their retreat, which I think was on January 30th. And so we turned that paperwork around pretty quickly. So I'd be happy to answer any questions.
All right, any additional comments on this?
Just one. Can I
Yes,
make a thanks? So, so Mary, so this is an additional staff from the, because I think they have an opening right now at Giving DuPage, right? Is that what Shirley said in the other meeting?
There's currently a part-time communication specialist position that is vacant.
Okay,
We've had extreme difficulty. We've gone through a number of really good part-time individuals who, ultimately leave because they want a full-time job with benefits. So it was just this constant cycle of hiring somebody really great in this part-time position. And then in some cases, I think the best one we had stayed a year and a half, maybe. And then others have been as short as 3 months because something full-time comes along and they're gone.
okay,
So-
and, yeah,
So when we looked at how to solve this problem, the problem was it needs to be a full-time position, but without additional funding, we couldn't do that.
okay, great. So then, excuse me, so then that ad will not be hiring them for that position. This is kind of cover for that, correct?
Yeah, there's no change to the total head count. It's
Okay.
just a modification.
Great. Okay, thanks so much.
Okay, good conversation on our informational item here. And so with that, I will, we can discuss it the next one, we're going to take it up on the next item anyway. So let's just take a vote, roll call on putting that on file.
Member Chaplin?
Aye.
Member Desart?
Aye.
Member LaPlante?
Aye.
Member Schwarzy?
Aye.
Member Selman?
Aye.
Chair Renahan?
Aye. All right, thank you. That's received and placed on file. With that, I will ask for a motion on the overlay, the FIR 15421, revision of personal head count, addition of senior intake and referral specialist, community services block grant, community services grant fund. Actually, I'm sorry. This does not have to do with the Giving DuPage. This is a separate item. We'll take that next. So a motion on 154-21, A1, 5A1. Have a motion.
So moved, Selman.
Second, Chaplin.
Thank you. Do we have questions or comments on this item? All right, roll call, please.
Member Selman?
Aye.
Member Chaplin?
Aye.
Member Desart?
Aye.
Member LaPlante?
Aye.
Member Schwarzy?
Aye.
Chair Renahan?
Aye. All right, thank you. That's approved. Do I have a motion on FIR 157-21, acceptance appropriation of the Giving DuPage staffing grant FY 21 in the amount of $20,000?
So move, Schwarzy.
Second, Chaplin.
Okay, here's where you can do your big discussion. Anyone? I would say I'm definitely not going to turn down money, right? So, Member Selman, please.
Just to briefly add to what Mary had shared on the Giving DuPage retreat, actually we ended up having it split amongst 2 days because there was a lot to talk about. I think this is a really great solution to get us to explore how the foundation can raise more money. It's just like, as Mary said, not only just hiring a part-time role is difficult, but keeping someone really talented in that role. So I think this will give us the salary dollars and the benefits to allow us to really give Shefali the tools she needs to, continue meeting the need. I think March 2020 showed us how much of a great resource Giving DuPage was when we had immediately someone we could go to for all of our urgent needs that arose, not just at the county, but our nonprofit partners throughout the county. So I just want to thank you all for your support of this. It's a really good strategic move for the DuPage group. Thank you.
All right, thank you. Any other comments? All right, roll call, please.
Member Schwarzy?
Aye.
Member Selman?
Aye.
Member Chaplin?
Aye.
Member Desart?
Aye.
Member LaPlante?
Aye.
Chair Renahan?
Aye. All right, thank you. That's approved. I have a motion for HHSP 33-21, Catholic Charities Hope House contract purchase order to assist homeless residents with housing, case management, financial assistance, budgeting assistance, job search, transportation. This is CSBG CARES Act, January 1st, 2021 through September 30th, 2022, not to exceed $175,000.
So moved, Desart.
Second, Chaplin.
Thank you. Questions or comments? Roll call, please.
Desart?
Aye.
Member LaPlante?
Aye.
Member Schwarzy?
Aye.
Member Selman?
Aye.
Member Chaplin?
Aye.
Chair Renahan.
Aye. All right, thank you. That's approved. Do I have a motion on HHSP 37-21? It's also a CSBG CARES Act, February 15, 2021 through September 30th, 2022, not to exceed $105,168 with the DuPage Health Coalition to help 313 DuPage County residents medical care expenses.
So moved to Desart.
Second, Chaplin.
Comments, questions on this item? You know, I actually do have a question on this. I'm just wondering, how does this come through HHS versus, say, going through the health department?
It's coming through HHS because it's a community services block grant funded activity. So HHS is the parent committee that controls the CSBG grant.
Okay, so essentially, it doesn't really matter subject matter, it's because they're a 501c3.
It's because it's so the county receives the CSBG grant from the state and then makes the determination how to utilize it. One of the areas that was identified in the needs assessment specific to COVID response for the CSBG grant was access to health insurance or access to health care. So the CSBG grant is being used to assist the DuPage Health Coalition in enrolling additional patients to provide them access to healthcare through their sort of consolidated charity care. Does that answer your question?
Yeah, it does. It does.
Yes. I mean, so the health department doesn't have any jurisdiction over how the CSBG funds are used.
Okay, I just understand that we just so rarely see health items on our agenda, health related, and I guess this goes to insurance as well. But thank you, Mary.
Mm-hmm.
Anybody else have any questions? All right, roll call, please.
Member Desart.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Solomon.
Aye.
Member Chaplin.
Aye.
Chair Renahan.
Aye. All right, thank you. That's approved. I'll ask for a motion to combine items B 1, 2, and 3. These are all contract purchase orders dated January 1st to December 31st of 2021 for low-income residents, services, foods, items in the amount of $25,000 apiece.
So moved to combine Desart.
Second, Solomon.
All right, thank you. Questions, comments? Let's have a roll call, please.
Chairman Renahan, if
Aye.
I may,
Yes.
thank you. I am not on this committee, but I'm sure you guys are tired of hearing me talk about diapers. I've been doing it since late last summer. So I'm thrilled to see this money coming for these types of items. But what I want an answer on is, why did it take almost a year of this pandemic to get this relief to the people of our county? And with the next tranche of money coming in April, how can we kind of move these types of things to the front of the line rather than to the end of the line?
I'll defer to Mary
If I
Kate.
may.
Yes, you may,
So-
please.
So the funding that the county provided to food pantries back in July of last year did include not just food, but any sort of essential commodities is how we worded it. So the we did not specify diapers specifically, but we did say for food and other essential commodities. So that did include things like cleaning products, personal care, diapers, those kinds of things. It was up to the individual food pantry to make the determination how to utilize those additional funds. In terms of this particular grant, we just have access to this grant now, and so that's why that's moving through now. So I don't think anyone disagrees with you that that's an absolutely essential commodity, and we did build that into our CARES Act food pantry assistance programs.
Thank you, Mary. By no means do I want to make this sound like staff did not do the right
No.
things, or I'm merely advocating for those people that are really having a problem
Sure.
in these areas.
Sure. And like I said, we didn't call it out specifically. But we did field a lot of questions with food from the 3 big food pantries that we provided that $125,000 to, specifying that yes, you can use it not just for food, but whatever else you need, any other essential commodities to be distributed to clients and residents in need is how we word it.
And do you know how many of the food pantries actually really have stocked these type of cleaning items and diapers and personal care items.
I would have to go through the receipts. There were certainly items that did not include food that were in the receipts that they submitted. But again, it was up to them to make the determination, what's the greatest need that they have.
Sure, of course.
Okay.
Thank you so much. Mary.
Sure.
Thank you, Member Rutledge, for making sure we take care of all the needs, right?
I'm trying.
Any other comments or questions on this? All right, with that, I will take a motion to approve 2021 11, 12, and 13 to West Bourbon Community Pantry, to People's Resource Center, and to Loaves and Fishes Community Services on these.
We took a motion to combine.
I think I
on the
already.
first one.
Oh, we're
On
still
the
voting
first,
on
yeah.
the point. I
Are you gonna
apologize.
combine them?
I think I would ask for a motion to combine. I guess we didn't vote on it.
Right.
Right.
We need to vote on the motion to combine.
Okay.
Do it. Roll call, please.
Member Desart,
Aye.
Member LaPlante,
Aye.
Member Schwarzy,
Aye.
Member Selman,
Aye.
Member Chaplin,
Aye.
Chair Renahan.
Aye. All right, thank you. Now that they are combined, I'm going to ask for a motion to approve 2021 11, 12, and 13, again to West Bourbon Community Pantry, People's Resource Center, and Loaves and Fishes Community Services. Do I have a
So
motion?
moved, Desart.
Second, Chaplin.
Questions, additional comments? All right, roll call, please.
Member Desart,
Aye.
Member LaPlante,
Aye.
Member Schwarzy,
Aye.
Member Selman,
Aye.
Member Chaplin,
Aye.
Chair Renahan.
Aye. Thank you. Those are approved. Do I have a motion to approve HHSR 155-21, a recommendation for first modification of CDBG agreement with a Little City Foundation, renovation of 2 Hanover Park CILA homes, project CD 20-03, revising the scope of work.
So move Schwarzy.
Second, Chaplin.
Questions, comments? Mary, can we just get a blurb on this?
Can you give an update on this one? I'm just gonna call on Dave.
Sure.
Dave? Thank you.
Hello.
Hi.
So basically, anytime they change their scope of work, they requires approval because we don't want them to be approved for one project and then turn around and do something different. The big thing with this one is they're not asking for any additional money. So they ran into a zoning issue. And so they had to change what their plans were, and including adding a sprinkler system, which they didn't anticipate. But they're not asking for any additional CDBG funds. Any overage that's being caused by this change is assumed by the partner. And so in that sense, their end contract amount with us will be the same.
All right, thank you. Any questions from the committee? Okay. Did we already get a motion in a second? Yes. All right, roll call, please.
Member Schwarzy,
Aye.
Member Selman,
Aye.
Member Chaplin,
Aye.
Member Desart,
Aye.
Member LaPlante,
Aye.
and Chair Renahan.
Aye. Thank you. We have DuPage Care Center request HHSP 35-21 for purchase order with Advocare Systems for rental and medical equipment bed for the care center from March 1st to 2021 to February 28th, 2022, not to exceed $248,760 per lowest responsible bid. We have a motion.
So moved, Desart.
Second, Chaplin.
Questions, comments? Roll call, please.
Member Desart,
Aye.
Member LaPlante,
Aye.
Member Schwarzy. Aye. Your mic's
I
off?
think you froze. No.
Oh, you froze? Okay, let's.
I'm not sure. My internet,
Are you aye?
my internet is having problems. You guys are kind of cutting in and out. I vote aye on that, if you can hear me.
Okay. Member Selman,
Aye.
Member Chaplin,
Aye.
Chair Renahan.
Aye. All right, thank you. That's approved. Can I have a motion on 2021-14 recommendation for professional services, legal services for DuPage Care Center, March 1st, 2021 to February 28th, 2022, not to exceed $20,000?
So moved, Desart.
Second, Chaplin.
Questions, comments? Roll call, please.
Desart,
Aye.
Member LaPlante,
Aye.
Member Schwarzy,
Aye.
Member Selman,
Aye.
Member Chaplin,
Aye.
Chair Renahan.
Aye. Thank you. That's approved. 2 budget transfers for the Care Center. The first is to transfer budgeted funds allowing for sufficient budget availability by payroll account to post payroll, $25,919. Do I have a motion?
So
So
moved.
moved.
So,
Second, Chaplin.
Questions, comments? Roll call, please.
Member Selman,
aye.
Member Chaplin,
Aye.
Member Desart,
Aye.
Member LaPlante,
Aye.
Member Schwarzy,
Aye.
Chair Renahan.
Aye. Thank you. Another budget transfer of the Care Center, monies to cover final year and end FY20, continuing collective budgeting, machinery and equipment rentals, $31,611. Do I have a motion?
So move Shorzy.
Second, Chaplin.
Questions, comments? All right, roll call, please.
Member Schwarzy,
Aye.
Member Selman,
Aye.
Member Chaplin,
Aye.
Member Desart,
Aye.
Member LaPlante,
Aye.
Chair Renahan.
Aye. Thank you. That's approved. We do have an authorization for overnight travel, weatherization assessor to Champaign, Illinois, April 19th to April 23rd, 2021, $1,044.20. It is a weatherization grant funded. I have a motion.
So moved, Chaplin.
Second, Solomon.
All right. Any deep thoughts, questions, comments? Member Solomon?
Thank you. I presume the answer to this is yes, but if COVID is still terrible and the person who would need to travel is uncomfortable traveling, we're able to get this refunded, correct?
We would get a credit for future training.
Okay, and I know it's grant funded, so it's not our dollars, but just making sure that if they feel uncomfortable traveling, we can push it back for their safety. Okay, great.
It's also just FYI, it is a mandatory training in order for a weatherization assessor to be fully certified to perform their work. They do have to complete a series of trainings that are offered by the state.
And they're still doing them all in person. They're not doing any remote. I know we've seen this in development too, that they've had people that still had to go down to Springfield or Champaign. All right, thank you, Mary.
Yeah, the only thing I would add is they do, of course, have safety protocols in place, and they've reduced the number of class sizes, and they have some of that procedure in place for the trainings. But they're all done in either South Holland or they're done in Champaign. So they either have to go every day to South Holland or they stay overnight in Champaign.
All right, thank you.
Thank you. Any other questions or comments on this item? All right, roll call, please.
Member Chaplin. Member Chaplin?
Aye.
Okay, thank you. Member Desart,
Aye.
Member LaPlante,
Aye.
Member Schwarzy,
Aye.
Member Selman,
Aye.
Chair Renahan.
Aye. Thank you. Do we have any residency waivers?
No, we do not.
No, we
This
not.
is Anita from the Care Center. We do not have any residency waivers.
Oh, great. Thank you, Anita. And then report from the DuPage Care Center.
Janelle's out of the office, so I'm here giving our report. Good morning, everyone. Good to see you all. I'm going to start off. Our COVID positive numbers have sharply declined. We've had only one staff person test positive in approximately the last 3 to 4 weeks, and no residents have tested positive. So we are very happy about this. Keeping these results in mind, we're going to be working towards planning for the next CMS phase of reopening for long-term care. It's pretty complex. There are several things we have to mitigate, so I think we're going to start working on this early. In terms of our room remodeling project, through the CARES Act, we had money that was allocated to us for creating negative pressure rooms, and that was on our post-acute care unit. These are 4 rooms that were being renovated. They are almost ready. We are waiting for the Illinois Department of Public Health to complete their inspection and give us the go-ahead so we can start using these rooms. I think Member Renahan, Chair Renahan mentioned this. Our Valentine's Day balloon sales were awesome this year. We sold over 950 and we made up to almost $10,000. So this is about $3,000 more than from last year. So we are very happy about these. And just to remind you, the proceeds from this go to our rec fund for our residents. The other thing that we've really got tremendous support from is our Amazon wish list. Given the pandemic, we have had more of a need for items that promote social interaction. They improve the, not only that, but they promote the psychosocial interaction. They promoting leisure activities that have to be now done in isolation when people are confined to their rooms. So we had lots of items that we put on our Amazon wish list, and the community response to this has been tremendous. So we thank everyone for the community for contributing to that. And with that, I think we had a lot of feel goods. I don't have anything else unless there are any questions.
Any questions from the committee? All right, well, thank you, Anita. Thanks for all you do over there. I'm glad to hear that there's going to be some more opening up so that everybody can see their family a little bit more. And great job on taking care of people when there's nothing to do. We to be in a senior center at this point, I can't even imagine. So thanks for all you do. I know you care.
We appreciate it. Thank you for all your support.
Member Renahan, I have some questions.
Oh, we've got some questions from Len LaPlante.
Yes. Anita, I have two questions. The first is about that Amazon wish list. Do you think that is that going to be kept up and available for people to purchase items still?
Yes, it will be kept up as we need items, as we note there are new items out there, things that will promote what I just discussed. Yes, we will be updating those, and we do update those on a regular basis.
Oh, wonderful. Okay, and then my second question is, have you noticed a change in, hoping an uptick in basically vaccine confidence amongst staff members, people choosing to get vaccinated?
I think we've noticed some, yes. I think a lot of staff were waiting for, the first round of vaccines and wanted to see how people would respond to that.
Okay.
So for our second round, we got more people sign up for that. It's close to 67%. And that is still good because we are part of a lot of cohorts. These cohorts are groups that meet together and they educate us on the infection control aspects of COVID. I will tell you what's out in the industry is 40%. So considering that, I think we've done well, and we'll continue to work with staff. I personally have talked to plenty of staff, going through the research, talking to them about the positives, not only just for the residents, but for them and their families also.
Yes, okay, I'm glad to hear that. Is there anything that we can do, or any connections that we can bring in to help increase that vaccine confidence to really, move it up from 67%, which I think that's what it was at last time, if I remember correctly. It was exactly 67% last time. So is there anything we can do, or someone we can bring in to speak to staff about vaccine confidence? Because I think that number really needs to go up with the new variants that are, arriving, basically.
Right. I can't think of anything off the top of my head right now, but I will keep that in mind. Okay. And we will see that, like I said, the cohorts have been very good with us. They take us through a lot of education on how to have these conversations with people.
Okay.
So I think they've been very, very helpful. For us, I know 67% sounds low, but when you hear about what's going on in the nursing home industry, I'm happy to report that we're at 67. Granted, we need to be higher than that, and we will continue to work on that. By no means have we given up on that aspect.
Of course. Okay, thank you so much, Anita.
Thank you.
Oh, thank you. Any other questions from the committee? All right, I will turn it over to Mary Keating for community services update.
Thank you. I know we've lost a couple members to transportation, so I hope that I can just take a couple more minutes to talk about a couple of updates. The first is, I just want to give you a brief update. You might recall back in the fall, the county allocated $1 million to the city of Aurora to then be provided to Hesed House for improvements to one of their warehouse spaces to make it acceptable and habitable for an emergency shelter. That those modifications have been made. Part of the agreement was that Hesed House agreed that they would begin accepting sort of overflow from DuPage pads. I was on a call, I think it was about 10 days ago now. It was the Friday right before the first bitterly cold weekend. And it was a collaborative conversation between pad staff and the Hesed House staff. They started talking about specific clients and moving specific clients who were reaching out to pads, getting them over to Hesed House, how the case management was going to work. So it was, and then that whole weekend, there were emails going back and forth between those two organizations to making sure that their street outreach teams were connecting with one another. I have asked, once they have that, really ironed out, because they're kind of right in the thick of it. Once they have it ironed out, I'd like to bring those organizations to the board for a presentation. But it was really great to see that investment made a significant impact on our ability to serve individuals experiencing homelessness during this bitterly cold period. So just a quick thing on that. And like I said, I'd like to bring them to the board for a presentation a little bit down the road. And then real briefly, the Strategic Planning Committee has asked that by the end of this month, we submit to them our strategic initiatives for the year. Obviously, my department is 90% of what we'll be doing is trying to make sure that we're utilizing the additional funding that we're getting from all kinds of different sources as effectively as possible. But I wanted to call out kind of 3 specific things that we'll be working on. Last year, our primary strategic initiative was all around outreach. We had lofty goals of how many in-person events we were going to attend, how many people we'd talk to. So obviously that didn't happen, but we will this year be continuing our outreach efforts, but really focusing a lot of effort this year on reaching out to communities most significantly impacted by COVID, both from a health perspective and an economic impact perspective. So working with those organizations will be a specific initiative that we'll be working on this year. We'll also be working on improving our online access to our services. We did, I think, a terrific job in 2020 of figuring out how to get clients information back and forth. We've got case managers taking pictures of documents on their phones and uploading things. And I think we need to really look at a more comprehensive way to do that. We also are working on the implementation of a Q-matic system, which will allow individuals to make appointments online. And then when we're back in person, once they come into the building, there's a kiosk so they can check in at the kiosk when they arrive. They get reminders about what documents they need to bring with them. At the time they check in, the case manager or intake worker who is assigned to them will be notified at their desk that your client is waiting. So it'll be a much more efficient way that we'll be seeing clients. The system is currently in use down in building and zoning. So we're just expanding our use of it. We'll also be continuing our exploration of implementation of a 211 system this year. We had some really good conversations with the Addison Dispatch Center last year with a possibility of them being interested in partnering and taking on overnight and weekend calls. Just so for some background, 211 is sort of a nationwide initiative that's a simple 3-digit phone number people can call when they're looking for information about social services in their communities. Most places in the country have had 211 up and running for quite some time. Illinois kind of lags behind. There are some areas of the state that do have it up and running. So it's because we run the information referral division. It's basically what our INR folks do. But 211 operates on a 24/7 basis. So it would be expanding our capabilities to include nights and weekends. The biggest hurdle clearly is identifying an ongoing source of funding for 211. But we've sort of got a model worked out of how we would operationalize it. It's a matter of identifying either grants or ideally some sort of ongoing permanent funding source to expand that service. So those are the 3 strategic initiatives that I think we'll be focusing on. And then the last thing I want to talk about was just an update on the IDA rent assistance program. They have sent us a revised draft of the agreement. I think the biggest thing that's in there is a solid commitment that any application from any eligible application that was received for a DuPage County resident will be funded up to that, whatever amount we cede over to them, you know, which would be up to maybe 27 million, the full amount. So there won't be any sort of, there wouldn't be any kind of randomization or lottery or anything, so that if an eligible DuPage resident applies, the resident will receive, or the landlord will receive that assistance. We're still working on sort of the timing of how the decision would be made. As you know, again, what we talked about was that there will be a period of time where that funding for each specific county will be sort of held in reserve to be used only for residents of those counties. But there will be a time at which those funds will be opened to sort of a pool. So we're kind of figuring out exactly how is that decision made and what's the timing of that decision. So I anticipate there will be another call this week to try and hammer that out. So I'm hoping that we'll have a final agreement to take to the board within the next, I would say, maybe 2 to 3 weeks. That's all the updates I have.
Great. Do we have any questions from the committee? Thanks, Mary. It's huge what you're doing right now. We're, happy to serve in this committee and whatever we can do to help, happy to do that. So any old business. Yes, Member LaPlante.
Sorry, actually, I think mine is new business. I got excited.
Okay. I don't see any old business. Let's take new business.
New business. I've brought this up before and I just want to reiterate it. I'm concerned with the timing of our meetings. I'm concerned that we're having a drop off because people have to run to their next meeting. And as you just said, Chair Renahan, that information that we're getting, that's why we're here. That information from Mary, that's our focus. And I would like to dive deeper into some of these issues, but there's that feeling of rushedness because we have to make it to our next meeting. So I'm making a very, specific request that we look into the timing, because I think we need every minute possible to address the impacts, both health-wise and economic, of COVID. And that's what this committee does. And I'm concerned we're not able to give it our full and complete attention when we're rushing from meetings or to meetings. So I'm putting in a very specific request to look into that during COVID. Thank you.
Okay, thank you. I think we're all on the same page when it comes to that. Any additional new business? All right, I will take a motion to adjourn.
So move, Selman.
Second, Schwarzy.
Thank you, Vice Chair Schwarzy. Roll call, please.
Member Selman,
Aye.
Member Chaplin, Member Desart, Member LaPlante,
Aye.
Member Schwarzy,
Aye.
Chair Renahan.
Aye. All right, thank you all. Stay
Thank
warm.
you.
Thank you.